Have you ever experienced that dizzying sensation, a sudden wave of lightheadedness that makes the world spin for a moment? Or perhaps you have witnessed someone suddenly collapse, appearing unresponsive, and felt that jolt of fear and uncertainty. These moments can be incredibly startling. When someone suddenly loses consciousness, it means they become unresponsive and unaware of their surroundings. This happens most commonly when there is a temporary reduction in blood flow and oxygen reaching the brain. Our brains need a constant supply of these vital elements to function properly, and even a brief interruption can cause a temporary shutdown. Several factors can lead to this abrupt loss of awareness. The most frequent cause is what is known as vasovagal syncope, or the common faint. This occurs when a specific nerve, the vagus nerve, overreacts to certain triggers like intense pain, fear, stress, or even standing for long periods. This overreaction causes your heart rate to slow down and your blood vessels to widen, leading to a sudden drop in blood pressure. With lower blood pressure, less blood makes it to your brain, causing you to lose consciousness for a short time. Another common reason is orthostatic hypotension, which is a significant drop in blood pressure that happens when you stand up too quickly, often after lying or sitting down for a while. Your body does not adjust fast enough, and the blood pools in your lower body, reducing flow to your brain. Beyond these more common and generally less serious causes, heart-related issues can also be a culprit. For instance, abnormal heart rhythms, called arrhythmias or structural problems with the heart, can prevent it from pumping enough blood to the brain. Other potential causes include extremely low blood sugar levels, especially for individuals managing diabetes, or a severe lack of fluids in the body, known as dehydration, which can lead to reduced blood volume. In rare instances, a sudden loss of consciousness could be a sign of a more serious neurological event like a seizure, which is caused by abnormal electrical activity in the brain, or even a mini-stroke, also called a transient ischemic attack, where blood flow to a part of the brain is temporarily blocked. Head injuries from falls or accidents, and even certain medications or drug reactions, can also lead to this unsettling experience. If you are with someone who suddenly loses consciousness, it is important to act quickly and calmly. Lay the person flat on their back and elevate their legs above their heart if possible. This helps to restore blood flow to the brain. Loosen any tight clothing around their neck to ease breathing. If they do not regain consciousness within a minute or two, or if they sustained an injury from the fall, or if they have known heart conditions, it is crucial to seek immediate medical attention by calling emergency services. For those who experience frequent lightheadedness or fainting spells, staying well hydrated, avoiding prolonged standing, and changing positions slowly can sometimes help. Understanding the difference between a simple faint, medically termed syncope, and other causes like a seizure, is important for effective treatment. A seizure, for example, typically involves convulsive movements and a longer period of confusion afterwards, while a simple faint usually results in quick recovery once blood flow to the brain is restored. It is crucial to remember that any episode of transient loss of consciousness warrants a medical evaluation to uncover its specific cause. A sudden loss of consciousness is your body's way of telling you that something is not quite right, and it deserves attention. Whether it is a common faint due to a temporary drop in blood pressure or something more complex, understanding the potential reasons empowers you to seek the right help. Consulting a healthcare professional can provide a clear diagnosis and guide you toward appropriate management, ensuring your overall well-being and peace of mind.